Hello viewers, today I am going to show you a small procedure in which we are going to reduce a dislocated first carpometacarpal joint. It's an extremely rare injury, and I think I am doing this case after probably a decade. It's very uncommon to see these injuries because it is well supported by many ligaments. However, our patient today has this injury 5 days ago, and he is presented to us with pain and difficulty in moving his thumb, and radiologically he has got base of thumb carpometacarpal joint dislocation, and today I am going to show you how to reduce it. So a patient is under the block. Now if you look at the thumb, unless you look at very carefully, you will see a small dip, and if you look at the other side, there is very slight difference. So from outside it can look very normal. Here he has got an abrasion. But if you take a X-ray in this particular view, so if we take an AP with hand in this position, I will show you how it looks on the C-arm. This is our trapezium. This is our first metacarpal. Looking at it, you may get a perception that this is congruent. So this is one of the reasons this injury gets missed, because it's rare, and also if you don't get the right images, it can be quite deceptive to read and you can miss this injury. It's extremely important that you take X-rays in different positions. So this is slightly oblique, and if we take a C-arm, just take a picture, Akash. So it looks completely dislocated. Now the best view to assess carpometacarpal joint, especially the first metacarpal joint, is the Roberts view, and I will show you how to take it. So your elbow is completely extended and pronated, and you put the hand upside down, and then you take the image, and I'll show you how it looks. So now you can see in this view that your metacarpal is come out anteriorly. Now once you have made the diagnosis, reduction is usually very straightforward. You just need to give a longitudinal traction, and there's no major soft tissue which can get interposed. So in this, I would advise to have some longitudinal traction and try to press the base of the first metacarpal to get this in reduction, in the position of reduction. So Manoj is giving counter traction. Now whenever you are giving traction on fingers, especially if you have painted with betadine, it can become quite slippery. It's always a good idea to have a gauge piece at the distal end, and it gives you a good grip when you are giving the traction. So I'm just giving a longitudinal pull. This is now 4 days old or 5 days old. Let's see if it comes easily or not. So I'm just giving traction, counter traction for some time, and I'll wait for a few minutes. So far we have given traction, counter traction for a few minutes. We have not heard any click or clunk suggestive that this has reduced. Hence I'm going to manipulate the base. So this is metacarpophalangeal joint. I am following the base of the first metacarpal, and it's just there, and try to see if I can get this reduced. Now to be honest, all we did was to give some longitudinal traction, and I tell you honestly that I didn't feel any click or clunk. It's an uncommon joint to be dislocated. I have not done many in many years, so I didn't feel a click. However, if I look at the position when we took the X-ray, it looks perfectly reduced. So now if you look at the carpometacarpal joint, it looks pretty congruent. Previously it was subluxed to completely dislocated. So I think just that longitudinal traction did the job. After that, I did manipulate the base of thumb. I tried to push it towards the trapezium, but I think combination of traction and pushing the base of thumb should be able to reduce this joint. Now once you reduce a joint, you need to reassess the stability. If most of the times once it is reduced, it becomes stable, and you don't need to put a K-wire. All you need is thumb spica for around a month or 6 weeks, and it does the job. But how to assess whether it's stable or not is to do a dynamic screening. So if you do a dynamic screening, Akash, It looks pretty good. So, it's if you feel that if you have any doubts, there's no harm in putting a wire from base of the first metacarpal down into the trapezium. Leave it for around 6 weeks, and then you can take it off. Now, initially, especially with a patient like this, I cannot put a cast. So, what I do is I just make a small something like a thumb spica. So what it does is it just keeps it in position for few weeks, and once the wound has healed, so what I do is I just take it across here. If Akash can come from this side, please. Prashant, sorry. So I'm just going to take this and then just wrap it around. Now this in itself is more than enough to keep the position of, can I have a crepe bandage, please? 4-inch crepe bandage. So unfortunately we didn't have a 4-inch, so just cut the 6-inch one. And then all you need to do is to go across the thumb, and this usually does the job. So we will keep this for a week, 10 days, and once the skin condition is amenable, we'll put the patient in a cast. So this is usually does the job. So just keep it in this position, and that's about it. But you need to keep it immobilized for at least 4 to 6 weeks, because that is the time it takes for ligaments to heal. So viewers, this was a demonstration on how to reduce a carpo-metacarpal joint. Now, while reducing it, I think usually just the traction and counter traction will do the job. In fresh cases, you might feel a click. Today, unfortunately, we didn't feel a click, and I did give a longitudinal traction for 2 minutes, and then I manipulated the base of thumb. I pushed it into its position. Again, I would say that I didn't feel a click, but radiologically it was nicely reduced. Once you have reduced it, it is extremely important to do a fluoroscopic dynamic examination to assess the stability, and if it is stable, leave it, put it in thumb spica for around 4 to 6 weeks, and that will do the job. If at any point if you feel it's redislocating or reduction is not congruent, then supplement it with 1 or 2K wires, because it's extremely important. The reduction has to be congruent, otherwise later on it predisposes to base of thumb arthritis. So thank you for watching this video. I am sure this will be useful in your career. Please give us a thumbs up, and please do subscribe and do share our channel. Thank you.